Chiropractors, how is your patient retention? Hi, everybody. Welcome to the KC CHIROpulse Podcast, brought to you by CATS Consultants and Chiro Health USA. I'm your host, Dr. Michael Perusich, and I'm joined by my guest host today, Dr. Alex Kallio. Dr. Kallio,
hey, everybody.
Good to see you. We talk about this thing called patient retention all the time. And I thought this would be a great topic for you and I to just banter around today. Effective patient retention is a lot different than effective new patient acquisition. And I think a lot of times we get so focused on new patients that we forget about trying to keep them in the practice. And that's really more important than anything.
I was just going to say that is not only many times more important, but sometimes harder to do, getting people in the door one time.
Yeah, it can be. When you think about that, if a patient only comes in one time, are they profitable?
Not a bit.
No. And if you've done any kind of promotion or anything to bring that new patient in the door, it might be third visit, fourth visit, fifth visit before they actually start turning a profit. If that's the case, even a patient that you bring in not on a promotion is going to take a few visits to be profitable if you really think about it. Because how long does it take you to process that new patient? It's a lot longer than just a daily visit for chiropractic care, right?
Yeah.
So because of that, if you spend 45 minutes, how much do you make per hour when you're just adjusting people? We always say you should be around $400 to $500 an hour, give or take. And so are you charging $400 or $500 for an exam? Probably not.
Yeah. Even if you are, what's your allowed fee? Insurance, you're probably not getting paid what that exam's worth.
No, not at all. So patient retention becomes this incredibly important thing. And so how do we affect that? It's all about really not patient education, but patient communication. And we've talked a lot over the years in our profession about patient education, which is great, but it's not the education component that retains patients in practice, at least today's patients. Patients are much more needs-based than they are information-based today. And so because of that, we've really got to look at different and more effective ways to communicate with the patient so they understand the need for care, they understand the value of care, and they understand why continued care, even beyond symptoms going away, why continued care is still appropriate.
Yeah. And a lot of that's, you got to start on day one, but not making the patient feel like they're drinking through the fire hose. We want to be able to communicate effectively, but in short bits that the patient's going to actually listen to and absorb within that visit. A lot of times those people are in pain when they're coming in, and you try to set them through a 12-minute video like we used to do, or some of those they're just tuning out. They're not taking a lot of that in. So we've got to really be mindful of how we're giving that information to our patients.
Yeah, I think that's a great point. And it's not just us as the doctor, it's our entire team needs to be communicating in the same manner, and even down to even having some of the same words and things when we communicate to the patient. So, and if we don't do that, the after effect is that patients begin to question why they're there. They begin to question what we're telling them. So everybody's got it in the office has to be on track with this. And you brought up one thing, simplicity. It needs to be simple. It needs to be patient understandable. Patients don't understand the difference between a spondylolisthesis and spondylolysis. I don't think I did either until about try 4 in school. We can't expect them to understand the big words. We got to speak to them on their level. And as much as it is verbal communication, it's also the nonverbal stuff.
Absolutely.
Well,
I mean, yeah, you want to make sure you're facing the patient, make sure you're making eye contact. Just some of those simple things that, again, in any sort of communication with, whether it's a patient or, gosh, even a family member, you actually look like you're listening to them. It becomes very important.
Yeah, it's very important because they're really there to see if they can build a relationship with you. Today's patients want to have a trusted relationship with their doctor. And if you're looking away, you're not really paying attention to them, you're not listening to them, maybe your nonverbals are very standoffish, then you're probably not starting out off on the right foot to build that relationship.
Agreed. Absolutely.
Yeah.
Yeah. And especially within that, it's the time we have a tendency to want to just, okay, it's day one. We have 20 minutes or 30 minutes or whatever. And we're going to teach them the entire litany of subluxation and chiropractic history on this day. They're not really wanting to hear most of that on day one. Well, you can break it down into much shorter segments And ideally, if you're doing it right, you'll have a lot of visits to be able to progress that education side and keep it more about the patient needs on that first day.
Yeah, so true. So true. So I want to break for a message from our sponsor here real quick, but I want to come back and I want to talk about some of the strategies behind communication and how to bring in the right principles of effective communication into the process as well. And even talk a little bit about where does that patient education component still fall into play? Because it's still important, but maybe not so much as you said on that first day. So we'll be right back. We're going to hear a quick word from our sponsor.
In today's economy, every dollar counts. Families are facing tough choices, having to reconsider what was once essential to them. But when it comes to healthcare, no one should have to compromise on their well-being because of financial constraints. That's where ChiroHealth USA steps in, the solution for your practice. We understand the financial pressures families are under, whether they're insured, on Medicare, or paying out of pocket for treatment. By offering discounts on care, you can ensure that your patients can still afford the treatment they need. At ChiroHealth USA, we're committed to making sure no family has to sacrifice their health due to financial hardship. We'll work with you to create a game plan that keeps your waiting room full and your practice thriving. And here's the best part. Offering affordable care not only benefits your patients, but also positively impacts your bottom line. So why wait? Join ChiroHealth USA today and join the ranks of the most successful practices. Because when you put your patients first, everyone wins.
All right, everybody, welcome back to the KC CHIROpulse Podcast, brought to you by ChiroHealth USA and CATS Consultants. We're here with Dr. Alex Kallio, and we're talking about the importance of patient retention and using better communication skills to create that retention. And Alex, as we were talking about, it all starts on day one. And probably even before that, it really starts when that patient decides to call your office for the appointment. So your staff has to be plugged into this effective communication strategy as well. But when we talk about some of the principles behind effective communication strategies, you brought this up a minute ago, active listening. We have to really be listening empathetically to the patient, right?
Yeah, well, absolutely. That's one of those, if we're not engaged in making the patient feel like we're listening. And then there's a little technique of repeating what the patient says to you to let them know that you've heard it, you've understand it. And obviously, yes, making it feel like you actually care about what they're saying and how that impacts their health.
Yeah. And I think it's important too that we speak in simple and clear language so patients really understand us on day one. And day one is about them. It's not about us. It's not an opportunity for us to show how smart we are or how educated we are or talk about how many letters we have behind our name. It really needs to be about the patient and making sure that we're empathetically plugging into what's going on with them and that we're giving them that confidence that we can help fulfill that need that they came to the office to get help with.
Absolutely. And that's partially tying their complaints or what they have, why they're there that day to how is it affecting their life? Digging that out a little bit if the patient's not real forthcoming with that, understanding how it's impacting their ability to play with their grandkids or golf or any of those types of things, and then being able to translate them getting better and back to those activities and how your care is going to help with that. And that really becomes that important aspect of day one.
Yeah, I think you hit on something really important, and that's digging deeper than just symptoms and helping the patient connect the symptoms, which some of them get so caught up on. My low back pain, 7 out of 10, doc. When does it hurt? It's 7 out of 10. Why does it hurt? It's 7 out of 10. And they're not dropping down to, oh, it's affecting my ability to play golf. And, oh yeah, I really like to play golf. How much golf do you play? I try to play 36 holes a weekend. How much golf can you play now? I can only play 9 holes. Now we're getting down to the nitty gritty of why the patient is there. And it's really important to question that patient down as much as you can. And plugging into that helps also build that rapport with the patient and build that good trust and patient relationship.
Absolutely. And it becomes a bit of a factor too, as you're progressing along with care of using that as part of that re-exam or show for, whether it's a show for need of more care as, hey, you were only playing 9 holes before, but now you're able to play 18, but you want to play 36. So we still got some work to do. We're getting better. We're seeing this progress, but we're not out of the woods yet. It becomes a little bit of that functional improvement discussion, which is what most of insurances are looking for now. It's not so much pain-based, but we're looking for function-based. And that works well within patient retention side. That's the biggest part. We're going to be able to keep people in the office beyond just the pain stage.
Yeah, that's so true. And so many patients come in just thinking, I just have pain. And they may have heard a buddy or something, especially if they're new to chiropractic, they probably asked other people, what's been your experience with chiropractic care? And a lot of the people they ask are people who are the once a monthers who love chiropractic care. And yeah, I go every month. And so when they walk in the door, their perspective is, I'm going to go to the chiropractor and they're going to get me out of pain with one adjustment. And then I just may have to come back monthly.
Yeah. Yep.
And so we have to think about what the patient's perspective is, where they've come from, how they were referred to our office or how they found our office, and what their expectation of care is. Because if we go barreling into a care plan that is way outside of their perspective and we haven't reset that perspective, that's a patient who's very liable to drop out of care.
Absolutely. Yeah. And a lot of that kind of knowledge comes from asking questions and then listening intently on that first day.
Yeah. Yeah. Those kind of things are huge. So we talked a little bit about having staff involved in this process. So where does staff come into play? There's day one, because they're typically the ones taking the new patient phone call. So they have to be plugged into it. So their conversation with that patient needs to be starting to set the stage of, hey, we're really going to dig into this and figure out not only what's going on with you, but what you can't do right now that you want to or need to do.
Yep.
And so having them well trained, not just in asking some questions over the phone, but really starting to build that rapport with the patient is incredibly important.
Yep. Absolutely. Couldn't agree more.
Yeah. One of the things that I think is good from an effective patient communication strategy is not so much just communicating with the patients, but having your staff listen to how you communicate with patients and you listening to your staff on how they communicate with patients. And then during staff meetings and things, unwind that a little bit, talk about it. How can we improve on that? How can we say things in a same manner? And here's a great example. If I tell a patient at the end of a report of findings that, when you go home tonight after your first adjustment, you may be a little stiff and sore. Here's what I want you to do at home. And they go to the front counter. And if that's not reiterated between leaving me and going to the front counter, patient does what? They a lot of times forget what I said because it only takes 10 steps before they forget somehow. You wouldn't think it would, but it does. But what if they say, if tonight the doctor said something about if I'm in pain that I should do something, do you know what he said? Oh, I have no idea. If your staff member says, I have no idea. That's not good communication strategy. Your staff should know exactly what you say to those kind of patients.
Or if you typically tell patients to put ice on, then they tell them to put heat. They're
exactly
being able to have that. Some of that is it's internal communication with your staff and making sure that everybody knows predominantly this is what you want patients to do in these situations and have that should all be trained and set out well ahead of time.
Yeah, exactly. So make sure that you've got good strategies in place for training your staff and there's a difference between teaching and training. Teaching them is telling them one time, hey, this is what I want you to say to patients. Make your training an evolving thing. Do it on a regular basis. And this is a great thing to do just real quickly before you start the day. Hey, we've got so-and-so coming in for a report of findings. They've got a hot low back. Let's make sure that we talk to them about taking home some biofreeze or using ice at home after their treatments. Let's remember to all communicate that to the patient.
Absolutely. Yeah. And that you get into sometimes there, like you said, patients forget or not. So if we can reiterate it multiple times throughout a visit from multiple staff people, they're going to be way more likely to remember what they've been told and way more likely to do it down at home as well.
Exactly. And Dr. Staff needs to be plugged in too on what your treatment recommendations are and what the treatment plan is. Again, if a patient goes up to the front counter and they're not scheduled out, they may say, I guess I don't have any more appointments left. And if the staff doesn't know that care is not over and that you want to see them back or that they should be on twice a week still for the next 3 weeks, if they don't know that, then they very likely are going to tell the patient, okay, well, just call us when you need us, which is nails on a chalkboard to me. Make sure your staff is plugged into what your treatment recommendations are and what kind of a treatment plan those patients should be on.
And I think research has shown over the years that we need to see and hear things, I believe it's 7 times before we actually learn something
Understand it.
or retain it. Even if it's, when do you want me back? And that should come from the doctor when the patient's getting off the table. Okay, Mary, we're going to see you back on Wednesday, or we're going to see you again this week. And then they get to the front and or the therapy, and there's therapy person. Great. We see you again on Thursday. And then they get to the desk, and they should hear these things from multiple people. Everybody in the office should be on that same page with it too.
Yeah. And you can even have a stopgap procedure in place. I'm going to give everybody a little jewel here. So in our office, anytime I would not communicate to the patient when I wanted to see them back, or if I didn't communicate it to the front desk, we had an automatic procedure. And that procedure was the front desk didn't say, we don't know when you're supposed to come back. They would say, you've been on once a week. We're going to keep you on that. If the doctor makes any changes to that, then we'll call you and reschedule, but just plan on being back here in a week. And so they just go by the same cadence of treatment schedule that they've been on.
Yep.
So
yeah,
that
we've got
way,
to set up the same way.
yeah, that way patients don't think that, oh, well, I'm out of visits, so I don't need to come back. Or you get up to the front desk and the staff says, we don't know when you need to come back. What'd the doctor tell you? That never works out the way you want it to. Have those good procedures in place. That's good, just good patient communication.
Absolutely.
Awesome. Alex, anything else to add? It's good talk.
I think the biggest thing is just make sure, again, listen intently, use good body language, really pay attention, reiterate what patients are telling you, and then be sure to repeat it. Just because you said it once, the patient probably doesn't have it in their head. So don't be afraid to repeat things.
Yeah. Well said. So that's a great place to close. All right, everybody. Thanks for tuning into the KC CHIROpulse Podcast, brought to you by Chiro Health USA and Katz Consultants. If you haven't done so yet, go to katzconsultants.com. Check out what we're doing for doctors, helping them build profitable practices. All right, everybody, from all of us here at Katz Consultants, we'll see you next time.
Everybody.